Sleep paralysis is a fascinating and often unsettling phenomenon that occurs during the transition between sleep and wakefulness. It is characterized by a temporary inability to move or speak while being fully conscious and aware of one's surroundings. This state can last for a few seconds to a couple of minutes and is often accompanied by vivid hallucinations and a sense of pressure on the chest. During normal sleep, our bodies enter a state of muscle paralysis known as atonia, which prevents us from acting out our dreams and potentially causing harm to ourselves. However, in the case of sleep paralysis, this atonia persists even after waking up, leading to a temporary loss of voluntary muscle control. One of the most striking aspects of sleep paralysis is the presence of hallucinations. These hallucinations can be visual, auditory, or tactile, and often involve seeing or sensing a presence in the room, hearing strange sounds or voices, or feeling a weight on the chest. These experiences can be incredibly vivid and realistic, leading to intense fear and a sense of impending doom. While sleep paralysis itself is not considered harmful, it can be a distressing and frightening experience for those who go through it. Understanding the phenomenon and knowing that it is a relatively common occurrence can help alleviate the fear associated with it. The cause of sleep paralysis. The exact cause of sleep paralysis is not fully understood, but researchers have identified several factors that contribute to its occurrence. These factors include disruption of the sleep cycle. Sleep paralysis is most likely to happen during two specific stages of sleep: during the transition from wakefulness to sleep, hypnagogic or preorbital sleep paralysis, or from sleep to wakefulness, hypnopompic or postorbital sleep paralysis. These transitions involve a complex interplay of brain wave activity, neurotransmitters, and muscle control, and any disruption in this process can lead to sleep paralysis. Rapid eye movement, REM, sleep. Sleep paralysis is closely linked to REM sleep, a stage of sleep characterized by vivid dreaming and heightened brain activity. During REM sleep, the brain sends signals to inhibit muscle movement, effectively causing temporary paralysis to prevent acting out dreams. In sleep paralysis, this muscle paralysis extends beyond the REM stage and persists upon waking up, leaving individuals aware of their surroundings but unable to move. Sleep deprivation and irregular sleep patterns. Lack of sufficient sleep. Inconsistent sleep schedules and sleep disturbances can increase the likelihood of experiencing sleep paralysis. Disrupted sleep patterns can disrupt the natural sleep cycle and increase the chances of encountering sleep paralysis episodes. Sleep disorders. Certain sleep disorders, such as narcolepsy, sleep apnea, and insomnia, are associated with a higher risk of sleep paralysis. These disorders often involve disruptions in sleep patterns, which can contribute to the occurrence of sleep paralysis. Stress and anxiety. High levels of stress, anxiety, and emotional distress have been linked to sleep paralysis. Stress can disrupt the quality of sleep and impact the brain's ability to transition smoothly between sleep stages, potentially triggering sleep paralysis episode. Genetic and familial factors. There is some evidence to suggest a genetic component to sleep paralysis. Research has shown that individuals with a family history of sleep paralysis may be more prone to experiencing it themselves. It's important to note that while these factors contribute to the occurrence of sleep paralysis, they do not necessarily apply to everyone who experiences it. Each individual may have unique triggers and experiences related to sleep paralysis. Understanding the causes of sleep paralysis can help individuals better manage and cope with the condition. Maintaining a regular sleep schedule, practicing good sleep hygiene, managing stress levels, and seeking treatment for underlying sleep disorders can all be helpful in reducing the frequency and impact of sleep paralysis episodes. Symptoms of sleep paralysis. Sleep paralysis is characterized by a distinct set of symptoms that can vary in intensity and duration from person to person. The most common symptoms experienced during sleep paralysis include inability to move. One of the primary features of sleep paralysis is the temporary inability to move voluntary muscles. Individuals may find themselves unable to speak, sit up, or make any intentional physical movements despite being fully aware of their surroundings. Awareness and consciousness. Despite the inability to move, individuals experiencing sleep paralysis remain fully conscious and aware of their environment. They may be able to see and hear what is happening around them, which can contribute to feelings of fear and unease. Hallucinations. Sleep paralysis often involves vivid hallucinations that can be visual, auditory, or tactile in nature. Visual hallucinations may include seeing shadowy figures, supernatural entities, or distorted faces in the room. Auditory hallucinations can manifest as voices, whispers, or other strange sounds. Tactile hallucinations may involve feeling a sense of pressure on the chest or being touched by unseen entities. Sense of pressure or weight on the chest. Many individuals with sleep paralysis report experiencing a feeling of pressure or a heavy weight on their chest, making it difficult to breathe. This sensation can be distressing and contribute to the overall fear and discomfort associated with sleep paralysis. Intense fear and anxiety. Sleep paralysis episodes can induce strong feelings of fear, dread, and anxiety. The combination of being unable to move, the presence of hallucinations, and a heightened state of awareness can lead to intense psychological distress during these episodes. Shortness of breath and rapid heartbeat. Due to the fear and anxiety experienced during sleep paralysis, individuals may also notice an increase in heart rate and difficulty breathing. These physical symptoms can further contribute to the overall sense of panic and unease. It is important to note that while these symptoms are commonly associated with sleep paralysis, not everyone may experience all of them. The intensity and duration of symptoms can also vary from person to person and from episode to episode. Understanding the symptoms of sleep paralysis can help individuals recognize and differentiate it from other sleep-related phenomena. It can also provide reassurance that the experiences they are having are a normal part of sleep paralysis and not indicative of a more serious medical condition. How to treat sleep paralysis. While there is no specific cure for sleep paralysis, there are several strategies and lifestyle changes that can help manage and reduce the frequency of episodes. Here are some approaches that individuals can consider. Establish a regular sleep schedule. Maintaining a consistent sleep routine can promote better sleep hygiene and reduce the likelihood of sleep disturbances that can trigger sleep paralysis. Aim for a regular sleep-wake cycle, even on weekends, and ensure that you are getting an adequate amount of sleep each night, typically 7-9 hours for adults. Improve sleep environment. Create a sleep-friendly environment that promotes relaxation and comfort. Keep your bedroom dark, quiet, and at a cool temperature. Consider using blackout curtains, earplugs, or white noise machines to minimize external disturbances that could disrupt your sleep. Practice relaxation techniques. Engage in relaxation exercises before bedtime to help calm your mind and prepare your body for sleep. Techniques such as deep breathing, progressive muscle relaxation, meditation, or guided imagery can help reduce stress and anxiety, which may contribute to sleep paralysis episodes. Manage stress. High levels of stress can increase the likelihood of sleep paralysis. Implement stress management techniques, such as regular exercise, practicing mindfulness or yoga, engaging in hobbies or activities you enjoy, and seeking support from friends, family, or a therapist. Improve sleep hygiene. Adopt healthy sleep habits to optimize the quality of your sleep. This includes avoiding caffeine and stimulating activities close to bedtime, establishing a relaxing pre-sleep routine, and creating a comfortable sleep environment that promotes restful sleep. Address underlying sleep disorders. If you suspect an underlying sleep disorder, such as sleep apnea or narcolepsy, it is essential to seek medical evaluation and treatment. Treating these conditions can help reduce the occurrence of sleep paralysis episodes. Talk to a healthcare professional. If sleep paralysis episodes significantly impact your daily life or cause distress, consult with a healthcare professional or sleep specialist. They can provide further evaluation, offer guidance on management strategies, and explore potential treatment options tailored to your specific needs. It is important to note that each individual's experience with sleep paralysis is unique, and what works for one person may not work for another. Finding the right approach may involve some trial and error. Additionally, while these strategies may help manage sleep paralysis, they may not completely eliminate episodes for everyone. Remember that sleep paralysis itself is not harmful and generally does not require medical intervention unless it is accompanied by other concerning symptoms. If you have any concerns or questions about your sleep health, it is always advisable to consult with a healthcare professional for personalized advice and guidance. Sleep paralysis is a fascinating and terrifying phenomenon that has puzzled and frightened people for centuries. While it can be a distressing experience, understanding the science behind it and taking steps to promote healthy sleep can help to reduce its occurrence. Thank you for joining us on this exploration of sleep paralysis. If you've ever experienced sleep paralysis or have any thoughts on the topic, let us know in the comments below. Don't forget to like, share, and subscribe for more mysterious and horrifying content from Arcane Anomalies. Until next time, stay curious and stay safe.